Now, this is a very interesting talk on
Good
basics
morning,
of
everybody.
lasers.
I'm going to talk about the basics of laser. Laser stands for light amplification by stimulated emission of radiation. What that means is we stimulate the atoms, and when they go up, and once we let them cool down, they emit a radiation, what we call a laser. Now, laser energy is different from the other energies in terms of it's monochromatic, it's only in one direction, and it's parallel to each other. So look into that picture, how does a laser light looks like? And when we look into the light from the lamp or from the torch, that is polychromatic, that is non-coherent, and it's non-collimated. So that's the basic difference by the difference between the laser and the other lights. Now, this is a very important slide if you want to understand how the laser is produced. So we got a tube inside, and we got this tube contains an active medium. Now, this active medium could be a solid when we call it as a ruby lasers or an APVIC laser. It could be a liquid when we call it the dyed lasers. When it could be a gas inside when we say it's a CO2 laser or helium or the neon lasers. So you have to understand this. It's all terminology depends upon what medium we use to produce the light. Now, then there is to excite these atoms, we need an excitation mechanism. There are three different ways you can activate the atoms, either by optical or by electrical or by chemical energies. So once these atoms, they release this energy, they gets bounced by a highly reflected mirror, which reflects 100% of the laser lights. So what we call rear reflector, and then this light goes out through the output mirror, what we is a partially transmissive mirror from which a part of this light is goes out and will do its purpose, what it's meant to do. So this laser can act as can cause a thermal effects, can cause a chemical effects, and can also cause you a mechanical effects by which we will get the results clinically. Now you also have to understand the concept of chromophores. So when we put in a light, let's say on the skin, so these light will be absorbed by something. Then only the energy will be transferred from one place to another and will cause an effect. So let's say when we use a laser for hair removal. So when we put in a light, all that laser gets absorbed by the melanin which is present in the hair, and those hair follicles gets damaged, and then you get a laser hair removal. Similarly, it happens in the tattoos. Similarly, it happens when we do the lasers of the varicose veins, where the heat energy gets absorbed by either the water or the hemoglobin. So there are main four chromophores by which the light gets absorbed. There are two basic types of lasers. One is an ablative laser. You can see what we have done here. We have actually vaporized the skin. So there is an ablation, there is a defect in the skin. Second is a non-ablative laser, where we just heat the skin there, but the tissue over there does not get vaporized. And the heat gets absorbed by the chromophores, and that heat gets released by the chromophores and damages the surrounding tissues, by which we get a clinical effects. Now comes to the next concepts of what are the different types of laser. There are so many terminologies, and normally the surgeons and the cardiologists, all the people who are not into lasers every day of their life, they get confused. Now you have to understand this spectrum, what we call a VIBGYOR. The visible light has got a spectrum. On the one side we got a violet light, on the other side we got a red. So any wavelength light which is lower than the red will be infrared. So infrared could be a near infrared, could be a far infrared light. And when we have on the other side of the violet, we call it an ultraviolet or UV rays. Or on the top of the other side is an X-rays, gamma rays, cosmic rays. But we concentrate on the visible spectrum lasers and an infrared lasers. I'm going to go into detail a bit more. When you divide this further, when you look into the visible light, look into that. The argon laser has got a wavelength of 488 to 514, so visible light. NDY can have a laser of wavelength 532 as well as 1064. So same compound NDY, which is a solid crystals, I told you, can produce two different wavelengths. 532, which is a smaller wavelength, which will have a superficial effects, and a longer wavelength 1064 will have a deeper effects. That's why two different wavelengths we can use. Similarly, a CO2 laser can have a wavelength of 10,000 nanometer, which can have a very deep effects. The larger the wavelength, the deeper it goes. So it's a very simple mechanism. There is another thing, different chromophores have got different affinity for lasers. Like in this example. So melanin, where you can see the black line, has got the highest affinity for a KTP, and the lowest for, when you go down for the NDY. When you look into the water molecule absorption coefficient is for, it starts from 1064 and keeps on going up. So that's why you have to understand the affinity is very different. When we look into the oxyhemoglobin, if you look into the NDY, it is very less gets absorbed. 1064 wavelength is very less absorbed by the oxyhemoglobin. So if you want to target an oxyhemoglobin, then you should use a KTP laser or a ruby laser. And if you want to target, let's say, a melanin, the highest absorption, so you can use a KTP or diode laser. So, the higher the absorption coefficient, the higher the damage is. Similarly, if you look at just the water molecules and you compare the ablative and the non-ablative lasers, look into this. The earlier water molecule gets absorbed by the NDY, but when you look into the ablative lasers, the CO2 laser or erbium white laser, they really gets absorbed into the water and caused you a lot of tissue damage, making it an ablative laser. Then there are two different type of wavelengths what we use in varicose veins. One is 1417, one is 1940. And if you look into 1940 nanometer wavelength, that cuts 4 times more absorption into the water, causing you more effects. Now, ND-Weig laser, Weig means yttrium aluminum incarnate, and ND is a chemical agent which activates this. It's called a neodymium. So this is put into the flash tubes, gets activated, and then it can produce various wavelengths as mentioned over there. And you can choose exactly what wavelength you want to use out of this. Now, anti-Weig laser has got various advantages. It offers higher gain, it has good thermal properties, good mechanical properties, and the efficiency of anti-Weig laser is very high as compared to the ruby laser. Then there are some basic terminology we need to look into this, One is a pulse width. Pulse width means the actual duration of the time laser is being applied to the tissues. Another important point is pulse repetition time. The number of times the laser is going to fire in 1 second. So it's very useful when we're removing the tattoo, let's say. If I'm going to have a low pulse repetition time, it's going to take me half an hour to finish the procedure. Once we know the patient does not have a pain, we can increase the pulse repetition time, and the higher amount of laser pulses are fired in 1 second, so I can do it much faster. Now, if you have a longer wavelength laser, it penetrates deep into the tissues. So means it will go much deeper, but the photons will carry a smaller proportion of energy. But when we use a shorter wavelength, let's say KTP laser, it is on the superficial skin, but it has got a much higher energy. So that's why it is much more aggressive. So you have to be a bit more careful. So here I mentioned, the IPLs, if you look into, they come into the superficial lasers. Weig is superficial. Look into the ND-Weig. It can go up to the subcutaneous vessels, quite deep inside. That's why ND-Weig laser can be used for micro closure of the vessels, what we call a Clark's procedure. The fluency is, the joules per centimeters. So how much energy you're going to give per centimeter is considered to be the thing. And these joules are calculated by how much watt you are giving in how much time. And then per centimeter will give you the leads. That means in a centimeter of vein, how much energy you are giving to a particular segment to burn the vein. The pulse, as I told you, it is a brief span of time when the laser is given. So it can be either expressed in milliseconds, nano, or the pico. So where you want the particles to just, the laser should be touched in a very small time, we use the pico lasers. Where the you want the effect of the laser to be bit per long, you can use a milliseconds. So this is how it works. Once you use a long pulses, uh, then you have less ablation. When you use, short pulses, then you get a much higher ablation. This is a very important thing what we use. If you have a shorter wavelength, short, short pulse width, small spot size, and low fluency. So this is how it works. So shorter wavelengths has, we always try to use shorter pulse width and the small spot size, because then if you have a larger spot size, the wavelength, the energy goes much deeper. If you have a small spot size, the energy remains much superficial. If you use a lower fluency, then the energy will be superficial. Then if you use a higher fluency, it goes down. Now this is a comparison chart between 980 nanometer lasers. You look into this, and 1470, 1940. The amount of energy which we used to use a 15 watt, in 1940 we used 3 to 5 watts. And the lead, you can see we used to use 150 joules per centimeter. Now we use around 40 joules per centimeter. And look into the damage. There used to be a lot of carbonization and perforation in 980, and it's a very uniform damage in the 1940, causing you less hematomas and less bruise. So 1940 is effective, safe, much more patient comfort, and we have done like more than 400 cases now, and we really feel that this is, for the varicose veins, this is a very, very good laser. Does it make a difference what wavelengths? Yes and no. What that means is, as you can see, all the lasers, they get attracted to the water, and there are minor differences which I've already mentioned in the last slide, which makes the patient experience comfortable. Carbonization happens with all the lasers, in some small and in some larger, and basically it depends upon how much energy you're giving per second in a centimeter. There are various different types of fibers which are there. You can use, various type of fibers, and this is the magnification of the fibers. You can see there are prisms at 6 millimeter apart, and they are like 1850 micrometers in external diameter. So this is a dual radial fiber. You can use a bare fiber, you can use a radial fiber, you can use a single radial double ring. Then there is a new fiber which is called a 5-ring fiber from Neo Laser. You can use that. So there are various fibers which are available, but there is not a single trial which has shown that is there a advantage in one over the other. So there is not a problem in using any of these lasers, laser fibers. Now there are slim fibers by Biolytics, which go through a 16 gauge radial slim, so you don't have to put in any sheath at all, which is very good. So if you have a superficial lesion, so APVIC laser can be used. It's a stable laser. Its depth is more than the other lasers, and it targets both hemoglobin and water along with myoglobin. KTP is very strong, and it is but useful for facial veins because they are very superficial and thin. Show you some examples of varicose veins. Huge varicose veins in the leg. Put in a 6 French sheet, 1940 laser, local anesthesia, foam sclerotherapy, and on table in 20 minutes you can get beautiful results. Another example, 3 months follow up with the laser and foam. Another patient with a venous ulcer, 4-layer compression dressings, lasers, antibiotics, and in 6 weeks you can heal these ulcers very well. Spider veins, they can be either dealt with a microsclerotherapy or with a transdermal laser. We can use an APVIC laser, a 6 mm spot, which is really very effective and really helps us in getting a very good results. So be a responsible laser clinician. Patient counseling is important, documentation is important, we must control the laser hazards, and we must care for our equipment. So I hope the basics of this laser is very, very important, for everybody who's doing the lasers. So that's why we prepared this lecture. Thank you.
Much, Dr. Ravul. It's been a very, very good talk about the basics of laser physics, and we are going to have a full session on endovenous lasers and their use in vascular interventions.